Since March of this year, over 60 million American citizens have filed for unemployment. According to Forbes magazine, economists believe that a 30% unemployment rate is possible by the end of the year. For most Americans, healthcare is tied to our employment, and because of this, millions of people are losing their health insurance when they need it most. Economists have predicted that health insurance premiums will likely increase by 40% in the next year due to less payers. Our current circumstances have illuminated our country's need for universal healthcare in an undeniable way. America is the only developed country in the world without universal healthcare, despite the fact that it would benefit millions of its own citizens. I believe that access to healthcare is a right, not a privilege, and I hope that by the end of my speech you agree with me. Imagine never having to pay for another medical bill or for a prescription refill, and not having to worry about how much it would cost you to have a basic procedure done. This is the reality of people living in every industrialized country except the United States. Most Americans agree that the United States is the #1 country in the world. Unfortunately, that is far from the truth. According to the Commonwealth Health Fund, the United States infant mortality rate is higher and life expectancy is shorter than any other country with comparable economies and universal healthcare. In addition, the United States have the highest number of chronic diseases, such as diabetes and heart disease, as well as the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. With our mostly privately funded healthcare systems, we are spending almost twice as much as other countries on healthcare, and we're getting worse outcomes. I've heard countless stories about Americans going to Canada or Mexico to have surgeries because they cannot afford to have it done here in the States. Our country has somehow made access to healthcare a political standpoint, and it should not be. Even countries with a two-party system like Canada believe that healthcare is a right and should be provided to every citizen. I invite you to watch this clip of Senator Bernie Sanders talking a little bit about his Medicare for All proposal that would have given Americans access to universal healthcare.
Senator Sanders, this is Sunny. You say that the coronavirus crisis proves that our for-profit healthcare system is a failure. Can you explain why your Medicare for All plan would work better in this kind of scenario?
Well, right now, there is, for two reasons. Number one, there is growing anxiety in this country that people are increasingly unable to afford health care, or that they may not have any health care at all. Right now, before the epidemic, we were looking at 87 million people who were uninsured or underinsured, and now, when millions of people are losing their jobs, they're losing their health care. What do? We have the absurd situation that the recent stimulus bill covered you for the cost of the testing that you may need for the coronavirus. It did not cover the treatment. So you've lost your job, you may not have any income, and now you're worried about health care. What Medicare for All does is not a radical idea. It does what every other major country on earth does. It guarantees health care to all of our people, not tied to employment. You lose your job, you got coverage. You're a small business person, you got coverage. No deductibles, no copayment. Second point about the dysfunctionality of the current system. How does it happen? I want everybody to think about this. We are spending twice as much per person as any other people on earth for healthcare, and yet we don't have enough ventilators, our doctors don't have enough masks or gloves or gowns. That doesn't sound like a strong public health system, the likes of which we should have.
Go, Sarah.
Every other developed nation in the world has universal healthcare, and America as a whole would be much better if we followed suit. Which brings me to my next point. A universal healthcare system would benefit millions of our citizens. Today, over 30 million Americans live without health insurance, according to KFF.org. That means that they do not go to the doctor or dentist, and if they have a medical emergency, it could bankrupt them. Universal healthcare would guarantee every citizen basic care regardless of employment. With the rising unemployment rates, millions of our citizens are worried about how they will support themselves and their families, and they should not have to worry about not being able to afford medical care on top of that. By eliminating healthcare costs, our country would take a step forward to shrinking the extremely large wage gap. People living in poverty struggle to afford basic necessities like food and shelter. They should not have to struggle to receive healthcare as well. According to American Cancer Society, The average cost of cancer treatment with health insurance is about $150,000. If an individual without health insurance were to be diagnosed with cancer, they would be looking at upwards of $1 million worth of medical bills. So I'm sure it comes as no surprise that in the United States, over half of the personal bankruptcies are due to expenses for medical care. Our country clearly prioritizes profits over human lives, and it is so blatantly obvious that something has to change. No one should have to choose between getting medical help or letting themselves die because they cannot afford to pay for their treatment and prescriptions. In addition, taking the responsibility of providing insurance out of the hands of employers would benefit just about everyone. Small businesses would not have to worry about having to pay their employees' salary on top of their benefits, thus allowing them to invest that money back into their companies. Large corporations would be able to give their employees more hours as well. I work at Target, and I know for a fact that they try to keep as many employees working under 40 hours a week as they can, because that way they do not have to provide benefits for them. If corporations like Target did not have to worry about providing insurance, they could allow their employees to work more, and they could even use some of that saved money to increase wages. It is more than time for America to join the rest of the industrialized world in providing health care for every man, woman, and child living here. We are paying far more money for far worse care. Also, insurance companies and hospital administrators can line their own pockets while bankrupting the poor. The millions of Americans without jobs or health insurance are more than just a statistic. They are your neighbors, your friends, and even some family members. Now more than ever, people are needing access to medical care, and the implementation of universal health care will greatly benefit just about everyone. Access to healthcare should be considered a right, not a privilege. Universal healthcare is not as radical of an idea as some people think. If it were, the 30-plus countries that provide it to their citizens would have seen it fail, but not a single one has.